Hi, my name is Dr. Joe Childs. I'm board certified functional neurologist, and today I'd like to talk to you about chronic knee pain and how we help people with chronic knee pain without drugs, without surgery. So this is going to be a great video if you or a loved one suffers with chronic knee pain, or if you've been told you need to have a knee replacement surgery of some type. So we specialize in treating patients that suffer with chronic knee pain, including the bone-on-bone type of knee pain where the healthy space between your tibia and your fibula, which makes up your knee, is starting to wear away. These are the types of people that have been told that they need a knee replacement or will eventually need a knee replacement. And if a knee replacement kind of scares you, if you're concerned about the recovery time, and you'd like to try a therapy that is highly successful in helping people with chronic and acute knee pain, then this video is going to really be eye-opening for you. So the biggest thing I want you to know is there are options available other than drugs, anti-inflammatory drugs, which aren't so good. You can't take them long-term. They're going to affect your kidneys, they're going to affect your liver, they're going to affect your GI tract. Injections and surgery. There are options out there. It's important to know. We're going to talk to you about that today. So your average doctor is about 17 years behind in the current literature and research. Now that's not to say that there's not some really great doctors out there that do some wonderful types of things surgery-wise, but most people are unaware that there are some things that they can do that can help them with chronic knee pain, that can make them feel better, improve the way they go up and down the stairs, get them out of pain, and have them avoid the need for a surgery, especially a surgery so soon. So we're going to talk about that right here. So our office utilizes the most recent types of rehabilitative therapies and cutting-edge innovations in helping people with multiple conditions. But one of the things that we do see a lot of is we do see a lot of people with chronic knee pain. So we don't just do one thing for knee pain. We do multiple things. So one thing that we do is non-surgical knee meniscal decompression therapy. The meniscus is the cartilage that separates the two bones, your tibia and your femur. And so there should be space there. And so when people start to get a thinning of that space, it's essential to know that there's some therapies out there. So the therapy that we do is it actually decompresses by creating a light force, and when we create that light force, what that does is it takes the pressure off between the knee joint, and so it actually causes there to be a sort of it's like the meniscus is like a sponge. It starts to suck up fluids, and it starts to bring in nutrition, and it can start to actually heal that spacing in there to some degree. We have had some patients that have had knee decompression done, and after so many sessions of that, we've actually seen a little bit more thickness, which will prevent them from having such problems, and certainly helps them with knee pain. We also do cold laser therapy. Laser therapy decreases inflammation, it increases angiogenesis, which is the improvement of blood flows and blood vessels in there. It stimulates the mitochondria, and it increases healing in that area. So we're going to do that as well as the decompression therapy. We also do rebuilder nerve stimulation, because we know that the nerves, these large diameter afferent nerves that control where you are in space and let you know where your knee is in space, tend to be dying off in people that have not only things like peripheral neuropathy, but knee pain and chronic lower body types of issues. So we're going to stimulate that. It's electrical type of stimulation. We wrap it around the knee, and it creates stimulation of these types of nerves that actually inhibit pain. And so we do that as well. It's called rebuilder nerve stimulation. And then we also do something called rapid release manual therapy. So rapid release manual therapy is a neurokinetic type of therapy where we're going to find out where you have tightness and weakness in the muscles that stabilize the knee. The popliteus muscle, the quadriceps, the gastrocnemius, all the muscles that really balance the knee. We can determine where those weaknesses are, and we can strengthen those specific areas, which is going to relieve pain and increase mobility in your knee. It's kind of our program is best described as a very specific rehabilitative program for the knee that also incorporates decompressive forces that take pressure off of thinning and degenerative meniscus. So what we do flat out works. Patients improve. If you click on this ad, you'll see testimonials of people. If you click on this Facebook post, you'll see testimonials of some of our patients we've seen. It's incredible to see people get better when they're dealing with chronic knee pain and avoid the need for surgery. So if you want to learn more about it, go ahead and click onto this ad, and you'll see that there's an offer. We'd like to prove it to you. And the way it works in our office is for $47, we have what's called our new patient special. If you click on the Facebook post, you'll see. But we're going to do an exam, x-rays, any necessary tests, and we also do 2 free care sessions so you can actually feel how the meniscal decompression, the laser, and the rebuilder helps. We're so sure that you're going to get some relief within the first or 2 sessions. We'll do free care sessions, 2 free care sessions along with the examination for you. So if you're interested in overcoming your chronic knee pain, if you have a family or friend that you would like to have come into our office and have this offer, just go ahead and click on the Facebook post, and you'll be brought right onto our website for chronic knee pain. Thank you very much.